Welcome to the Birds and the Bees podcast. This is Braxton Dutson.
That's the key. People aren't talking about it.
Everybody needs to know that porn is not a documentary.
It's not like if we don't talk to kids about sex and sexuality, they're not going to hear about it. They're just not going to hear about it from us.
They have tons of questions, they just don't know how to ask them.
All you have to do is be one chapter ahead. You don't have to know everything. Just one chapter ahead of wherever your child is.
Hey everyone, this is Braxton Dutson, your host of Birds and the Bees podcast. I'm a licensed clinical social worker and a certified sex therapist. I practice here in Salt Lake City, Utah, and I am bringing you this episode of Birds and Bees podcast to best help you understand the different tools and tricks that you may need in order to improve your relationship, know what to talk about with your kids, and I do that by interviewing top professionals in the sexual health and relational health field. And I'm real excited to bring you the episode for today, which is with Shannon Hickman. And we're going to be talking about erectile dysfunction, delayed ejaculation, and premature ejaculation. Now, this is going to be a two-part series because this is a lot of information to cover. We're going to be talking a lot about it from the DSM, the way that you are diagnosed through this, and a lot of the misconceptions that people experience feeling like, oh no, I've got delayed ejaculation, or how do I know if I have erectile dysfunction? These two episodes are going to be for you. We're going to cover a lot of the questions that people have, as well as what a lot of men come into the office very worried about that maybe you don't need to be so worried about. Now, understand that this episode is not meant to help you diagnose yourself or to be used as a medical replacement. If you feel like you're experiencing delayed ejaculation, premature ejaculation, or erectile dysfunction, it's important that you go talk to a doctor prior to, or get in and talk to a therapist. However, making sure that you take care of yourself medically is important. This episode is not supposed to change your self-care through a doctor or a primary care physician. But with that, let's get on to the episode because there's a lot of great information that Shannon's got for us today. Now, remember, when you hear this episode, there's a good chance that there's not a lot of people that are talking about it. However, I'm fairly certain that a lot of men have experienced thoughts of this. So share this with a friend, even if you share it in kind of a joking way, like, hey, can you believe they're talking about this episode like that? You might be able to help someone shift a lot of their anxiety around these three topics. So don't feel afraid or ashamed to be able to say, hey, there's this episode on premature ejaculation. Maybe even practice saying that. That can be kind of tough sometimes, or even laugh about it. But I am really excited to bring this to you, and I would love to hear your feedback on the episode as well. Be sure to leave an iTunes review to let us know exactly what your thoughts were, especially if you're enjoying the show. I'd love to hear your thoughts and comments. If you have any ideas for future episodes or questions that you have, give us a call at 385-449-1818 and let us know what your thoughts are, what you'd like to hear about. We love to get feedback from our listeners. Thank you again for tuning in on birdsandbeespodcast.com, iTunes, Stitcher, Spotify. Y'all are great for tuning in, and I am really appreciative of the support that you bring to Birds and the Bees podcast. Now, on to the interview with Shannon Hickman. Hope you guys enjoy these next two episodes. All right, welcome to the Birds and the Bees podcast. This is Braxton Dutson, and here I am with Shannon Hickman, LCSW from Salt Lake City. Thanks for joining us, Shannon.
Thanks for having me, Braxton. I'm really looking forward to it.
Me too. I've been really excited to have you on the show. We're going to be talking about, for the next couple episodes, we're going to be talking about erectile dysfunction, premature ejaculation, delayed ejaculation. So this first one that we're going to be going over is premature ejaculation. But before we get into all that, Shannon, I want to hear a little bit about your story. Like, how did you end up becoming a sex therapist, a certified sex therapist nonetheless, and the people that you work with?
Sure. Gosh, it started probably close to 20 years ago. When I was about 18 years old, I started working for an assisted living facility and just really enjoyed working with people. And the sex therapy piece came back in later in life, but I remember my sister and I watching actually an episode of Oprah, and she had sent a couple, I think she'd maybe had the woman in the relationship had some sort of sexual trauma in her past. and she'd sent the couple to Hawaii on this retreat, but also included intensive sex therapy. And I just remember her talking about it on the show and how amazing and what an impact it made on their life together, and how incredible that healing process was for her. So I remember it piquing my interest clear back then. And then I spent probably the first, 10 years of my social work career in the healthcare field, and realized that the one piece none of the providers were really willing to talk about was sexual health. And so that kind of led me to open my private practice, and my good friend, Kristen Benyon, and I decided to kind of embark on this journey together. And we went to an ASEC conference in Miami. It all just kind of spiraled from there, and it's been what I'm most passionate about. And I love working with couples and individuals related to sexual health and sexuality.
No way. So you and Kristen Benyon were like, okay, so you're friends like beforehand, or were you in the medical field together?
We were working at the U of U in the ER together as crisis workers.
Crisis workers in the ER.
Yeah. We just started looking it up one day and decided this is what we kind of had always been passionate about and really wanted to do. And so we went together to Florida to the conference.
Wow.
And loved it. Met the most amazing people, and loved what we were learning about and hearing about, and felt like this was kind of where our careers needed to head. And at the time, we didn't really have anyone in Utah that was an ASEC certified sex therapist. I think we had one, Colette Milan, and that was it.
Colette was the only one, huh? Mm-hmm. Holy cow. And she's up in Ogden, right?
Yeah. Mm-hmm.
Yeah. So she's up there, and Kristen's down in Utah County, and you're here in Salt Lake.
Yeah.
Wow. I had no idea. I didn't know that part of the story. So you've got Core, your company, or your practice is Core Healing, right?
Core Healing Counseling. And I'm in Murray. And I'm also a Gottman trained therapist, so I see a lot of couples. Mm-hmm. And
wow, there's a process too. You've gone through 2 certification programs that are just beyond me sometimes.
Definitely. So I see a lot of couples, and I treat a lot of clients who come from Mormon backgrounds or still practicing Mormons, and also a lot of couples who are not, who come from other various backgrounds.
Well, and then you ended up presenting at that very conference that was in Miami. I'm sure it was a different place, but you presented at the ASEC conference on this specific topic about premature ejaculation, right? Yeah,
well, I presented to the Utah group, the ASEC group.
Oh, the ASEC Utah group. Gotcha. Yep. So the ASEC, the local one here. Mm-hmm. That is awesome.
On premature ejaculation. So, yeah, I joke that I'm the local, penis expert.
The local penis expert. Yes. Well, I have the right person here then, because I'm really curious, and I get a lot of individuals coming in talking to me about premature ejaculation, and it really comes down to there's so much anxiousness when they come into my door and they're like, hey, I think I've got premature ejaculation. I don't know, how long I'm supposed to be going for. And I mean, do we have a working term for that? How do you diagnose if someone actually has premature ejaculation?
So in the DSM, in the DSM-5, the definition of premature ejaculation is persistent or recurrent pattern of ejaculation occurring during partnered sexual activity within approximately 1 minute following vaginal penetration and before the individual wishes it. So in other words, they want it to last longer. Mm-hmm. It must have been present for at least 6 months and must be experienced on almost all occasions of sexual activity and causes clinically significant distress in the individual. The sexual dysfunction is not better explained by a non-sexual mental disorder or a consequence of severe relationship distress or other significant stressors, and is not attributable to the effects of a substance, medication, or another medical disorder. So really what I let clients know is I ask them, are you able to last longer than a minute? Because if you are, then you don't actually have premature ejaculation. Mm-hmm. I can teach you to last longer using a lot of the same techniques that we would use, but by clinical definition, you don't.
So you wouldn't get the diagnosis if you were to end up if you last longer than a minute.
Yeah, exactly. And I don't know if you want to talk about this later, but that I also let them know, and I do a lot of exercises. I'm like a whiteboard junkie. So I do a lot of exercises in my office with couples and with individual clients. But the actual, typically the average length of sex is 2 to 8 minutes.
2 to 8 minutes. So even just a minute longer,
Exactly.
and you're into the average.
You don't have it, you're good.
And we're talking penile vaginal intercourse. That's 2 to 8 minutes.
Yeah.
Man, that changes things around when people are watching pornography or they have all these expectations of going for forever.
Oh yeah, and that's what they show in the movies and TV and
no, for real, right? Especially in movies
all
and
night long, right?
Uh-huh.
They go and go and go.
That's what gets me is the songs where it's like we go all night long or 7, 8 times. I was like, I don't know who all these people, and I know there are people that are totally, that can and do, and that is wonderful, and I'm so excited for them. And that's just not my, I guess my personal forte. I get super tired.
And it's very rare, I would say, because there's a refractory period.
Yeah.
So the refractory period for men is the time between one ejaculation to the next. And as men age, that refractory period typically gets longer and longer.
Gotcha. Yeah, and I think if I remember correct, it's roughly around 15 minutes, even at the age of 20 or something like that. 15 minutes tends to be the average refractory period. I'll have to fact check that, but if I remember correct, that's what it is.
Yeah.
So knowing that we've got this under a minute almost every time for at least 6 months, and you're frustrated with it, what do we end up telling people that experience? They were coming in saying, "Hey, you know what? I'd like to last longer," or I don't know what else I can do, but my partner's not being pleased, and I'm not excited about this, and I need to last a whole lot longer. What do you end up talking to them about, or what do you tell them?
Sure. So really, a huge piece of a lot of this work that I do, if men come in with either premature ejaculation, erectile dysfunction, or delayed ejaculation, talk a lot about kind of switching from a performance model to more of a pleasure model. Because like we just talked about, most of media, you've got, if they're watching any adult films or, movies, television, magazines, we're getting oftentimes a very inaccurate picture of what sex is supposed to look like. So one thing, not only do we make sure that, okay, is it a minute or less? If it is, oftentimes I find out if they've seen a urologist, if they've had any hormones checked. I do a pretty in-depth mental health assessment to see if anything's going on like that. And then also talk with them about the relationship and to find out if, maybe there's any distress that's going on in the relationship, kind of like it talked about in the DSM definition. And then typically if they haven't seen a urologist who specializes in sexual health, oftentimes I'll refer them just to rule out anything medical, just to make sure that there's not something medical going on in any of these cases with premature ejaculation, with, delayed ejaculation. And for just the purpose of this podcast, I'll just refer to it as PE most of the time. But with any of those, I always make sure to rule out anything medical, because we can do therapy for a really long time. They'll learn a lot of great things. They'll walk away with a lot of, a better sex life, but and a better framework for sex. But if there's something medical going on, there's not a lot we're going to be able to do.
So let's break that down. We've got medical things. What could possibly be going on with medical stuff? I was hearing things about like hyperthyroidism that could possibly be something. Does testosterone play into that? Do you know?
Sure. Yeah. So hypothyroidism, it can be sometimes medications that they're on.
Oh, yeah.
I've actually seen in my practice sometimes where clients will have ADHD and they're doing really well, and they're not doing well in life, but they're doing well sexually because they can last a long time because they're not as focused. And then all of a sudden, or ADD, and then all of a sudden, they get on like Adderall or Vyvanse or something, and now they're able to focus better, but they have difficulty lasting long.
Because all of a sudden they're focused on the sexual experience versus bouncing all over the place.
Yeah.
More in the present moment, I guess you'd say. Mm-hmm. And I think this goes important to say that there's a couple different, there's two. There's two ways to identify PE, where we've got lifelong
Which
essentially.
Has always been an issue.
Yeah, ever since you've had your first sexual experience until now. And then you've got acquired PE, which is what we're talking about, right? Where we get, it could be anything from anxious relatedness, life changes, medication. Do SSRIs, holy cow, I can't remember what SSRI stands for off the top of my head.
Serotonin.
Rehabilitator, inhibitors.
Both of us are missing it.
But together we got it.
Yeah. So, acquired develops after you've had previous sexual experiences without ejaculatory problems. And then, like we just talked about, lifelong premature ejaculation occurs all or nearly all of the time, beginning with the first sexual encounter. Mm-hmm. And then you talked about like causes. It can be medication or substance induced. So yes, it can be all kinds of different medications, including SSRIs. However, a lot of times I find that affects more often than not delayed ejaculation or erections.
Oh, okay. Okay, that affects those more often.
Mm-hmm. Some research has been done to indicate there may be a genetic component to PE. I don't remember where I read that because it's been a while since I put this presentation together. Mm-hmm. But it can be inflammation and infection of the prostate or urethra. Like you said, Braxton, hyperthyroidism, any abnormal hormones. So it's really important for them to go in and have their testosterone checked, have their free testosterone checked. Mm-hmm. And sometimes erectile dysfunction, and we can go into this in depth now or later if you want, but erectile dysfunction can lead to premature ejaculation.
Oh, really?
And vice versa.
So back and forth, huh?
Uh-huh. Because what happens is clients all of a sudden are trying any tactic they can to last longer. So they're not present. They're thinking about the basketball game. They're trying to think about dinner at grandma's. They're thinking about anything they can possibly think of besides actually being in the moment and what's going on within their body. And so because they're so disconnected, it often can lead to erectile dysfunction.
Oh, wow. So they're trying to stay away from the sexual pleasure, avoiding the sexual pleasure. And when the sexual pleasure is based on wherever your mind's going, does that lead to some anxiousness, or is it just the sheer fact that you're not present, you're not being a part of it, you're losing that sexual experience? And so you end up...
all of a sudden arousal changes, desire changes, everything. And so they're not connected with their body as much anymore.
Yeah, it sounds like when you get into a place of not being connected with your body, and we start causing a lot of problems. Right.
So these are psychological or biological, right? That we've just talked about. Anxiety can be one, which is definitely related at times to erectile dysfunction too. Mm-hmm. But anxiety because you maybe already had anxiety to begin with, or you have anxiety now because you want to last longer and you're not able to. And sometimes that can cause problems in the relationship.
I think that's what I end up seeing the most in my office when people come in and they're talking about erectile dysfunction or premature ejaculation that a lot of the time they're just so worried. It almost starts this anxious cycle that someone might be, their partner approaches them for sex and they're like, oh no, what if? Yeah. And what if I ejaculate too fast? What if I can't please my partner? What if? And they continue to have this thought go over and over in their mind, and it ultimately goes from that into trying to perform, and then the performance ends up becoming even more anxious. Something happens, and when something happens, it's like, see, I knew this was going to happen, and it continues to reinforce what if. Or sexual experiences are something to be afraid of or something to avoid.
Exactly. And that's what I tell men a lot of times, is, and because of that performance anxiety, oftentimes they're withdrawing. They stop initiating. They don't want to, get into those situations because, they're so worried about how they're going to perform, and they just kind of know it's not going to go well. Mm-hmm. And also relationship problems can be a cause of PE as well.
Oh, so if you're having distress in the relationship.
I've seen men who have had challenging relationships, and they have premature ejaculation, and they leave that relationship, get into a relationship that's healthy, and they no longer have problems with premature ejaculation.
Wow.
I'd say that's probably, not as common, but definitely.
Yeah, so the recommendation is not, well, if you got premature ejaculation, end your relationship.
Try to find a new partner.
Kick him to the curb. No. Go see a therapist first.
Yeah. And a urologist.
You're right. We got rule out some medical, rule out some mental health, and then experience that with a therapist.
Exactly.
So why do you think
those are the causes?
Yeah, why do you think that we've got so many men that are, dealing with or gauging? How are they gauging their satisfaction on sexual intercourse, on this premature ejaculation? And I mean, it seems like the whole thing is based on how long it can last, how long it can go for, and that kind of dictates me being all that is man. Right,
and it's defined by penis-vagina intercourse.
Mm-hmm.
So a huge piece of this is, okay, let's reframe, let's broaden our definition of sex, and what else can be pleasurable. And one thing I definitely ask these men when they come in is, first we go through, like I said, is it a minute or less? And then it's, does your partner want you to be lasting longer? So a lot of times they have never discussed it, and their partner's fine with the penis-vagina intercourse.
Mm-hmm.
As long as there's a lot of foreplay and a lot of other, sexual experiences that they're having, and it's not just based on penis-vagina intercourse, they can have really great sexual experiences.
Wow. So being able to have just that communication, that first, or that ability to talk about what the expectations are, they may be putting themselves in a situation that is an undue expectation.
Yes, definitely. And if the partner is critical or, critical, judgmental, or, maybe shaming about any of this, it creates much more of an issue and even more anxiety. So it's really important for the partner to be gentle. And for the couple to be able to communicate about this.
Okay, so having the communication.
In a healthy way.
Yeah. I mean, I could see how that would really... can we talk a little bit about how society... I know we touched on it a little bit, but where do we know where this started, where all of a sudden you have to last super long to please your partner, or where are we getting this that you need to go forever, and that the ultimate... the ultimate part of sex is to last for 20 minutes, 30 minutes, and then have an ejaculation. And I don't know, do we know where this is coming from? Is it just...
Well, so I think when we just look at media and cultural influences, what messages do men and women get about sex from the media, right? Men are supposed to be strong. They're supposed to be able to perform to the best of their abilities in all aspects of life, right?
Mm-hmm.
Sports, providing for their family, work, etc. So,
All which are stressful.
yeah. And so sex just becomes an extension of these beliefs, right?
Mm-hmm.
Men are just supposed to be really good at all of these things. Like we already talked about, in the movies, it's portrayed as lasting for hours. And that also men are able to just perform immediately on the spot.
Ooh.
And another one I think that comes up a lot, and I talk about this in the exercise I do with couples, because we go through the performance model and we talk about all of the ways in which we gathered beliefs about what sex should be. Mm-hmm. One of them is that men, they're the dominant role, right? Mm-hmm. It's normal for men to want a lot of sex, and they're supposed to kind of be the ones that are providing women the pleasure. And in the performance model, most of the time when we think of sex, we think of penis-vagina intercourse. We're not thinking of anything else really outside that experience. And for most women, orgasm comes from clitoral stimulation. It doesn't come from penis-vagina intercourse.
Yeah.
So I think it's just a ton of misconceptions.
Completely. I like to think of it.
The lack of education.
Totally. I like to explain it, or I think of it as more of a, have you ever seen American Ninja Warrior?
I haven't.
No? Well, for anyone out there listening that...
No, yes, I have. Yes, I have. Recently.
This is the one I was going to say, maybe if I start to, even if you don't watch it...
It's crazy. Yeah. No,
I think of it a lot like that. The couples that come in to see me and we're talking about are individuals. I mean, it is seriously like you start at the beginning and they ring the buzzer and it's like, okay, it's sex time. Let's go. Yeah. And you start running and the first part is a little bit easy. Maybe you're holding hands, you're kissing, or, like in the thing, they're jumping from platform to platform and everyone gets past that first part. And then as it goes on, it perpetually gets harder and harder. And I mean, for the sheer fact that couples experience it kind of like this, and ultimately the goal is to get up the wall and to press the cool red button that then sends confetti into the air. I mean, I cannot think of a better
orgasm, simultaneous orgasm every time, toe curling, passionate sex. Right?
Yep, that. I mean, I can't describe a better way. There's confetti everywhere when you watch the show and they hit the button. It's like it's amazing, but then when you fall in the water. I mean, it's like wah, wah, or whatever sounds it makes. And everyone's like, oh, I can't believe you didn't make it past that. And I see couples doing this all the time when it comes to sex. They're like, all right, I think we're ready for the gauntlet. And they start going, holding hands, cuddling, kissing. Okay, we move from kissing maybe to oral sex, maybe to passionate kissing or touching. And then as it moves farther and farther up, for a lot of individuals, the anxiety starts to build even more because there's more to lose. You fall farther. If you hit if you fall off and you're not able to have an erection, you ejaculate too quick, or, if the woman is not experiencing the pleasure she needs in order for an orgasm, all of a sudden it's like, you know what, we need to bail. We need to get out before we fail this. And I love that you're setting this up when it comes to what other ways do we experience pleasure besides having to hit that simultaneous orgasm button. And even then, are we going to do that simultaneously? Because that can be a feat in of itself too.
Oh yeah. Paul Jonas talks about that in his book and Guide to Getting It On. Like, it's pretty rare that couples, he calls it blast off together.
Blast off.
But yeah, there's I'm looking at, you guys can't see it out there, but one of my slides from my presentation, and I've got stud delay spray. I mean, this is everywhere.
Stud delay spray. I haven't heard of that before. It's
from a magazine. These are pictures, things, all over that we see last longer, how to last longer, how to get a bigger penis.
That's the one that cracks me up.
Right. You can be 2 inches. You can grow 2 inches.
It's like, who in the hell can grow 2 inches like that?
It's really, really common, right? It's out there everywhere. Mm-hmm. And so helping them kind of transition to letting go of those expectations, right? But this is what it has to look like. Because oftentimes when we do that and we go in with those expectations, we're setting ourselves and our partner up to fail. And when we fail, it's like what you're saying, that wonk wonk, right?
Yeah.
Everyone like rolls over, going to the opposite sides of our bed, and now the sexual experience is over, right? But what we know is that a lot of times with premature ejaculation, you can go again in a little while. And so sometimes one of the ways, and I know this won't work for everybody depending on belief systems, but sometimes if you masturbate before a sexual experience, you'll be able to last longer if you've already ejaculated. So there's a lot of ways that couples can work on that together.
Definitely.
But it doesn't have to just end. The experience doesn't have to just end. And that's a huge piece of what I educate.
That's what I find fascinating. It's based on the male ejaculation.
Yeah.
That a lot of times, like, oh, I'm out. See ya. It doesn't necessarily matter. And for some people, it's not. But however, as we're looking in a societal context, it's like, oh, I came too quick, and then it's over and it's done. Well, I guess we'll try again tomorrow, or now I'm really embarrassed. And then we get all the jokes. I think the jokes are what I heard the most growing up in high school and stuff, where it's like, you're gonna go too fast. You're way too this or that. And if you can't last long, then you're less of a man, and I'm gonna make fun of you. And there's jokes all about it. You're like, oh, at least, someone's not coming too quick, or whatever may happen. It's like all innuendoed over to the partner, and everyone chuckles and laughs. But at the same time, it's not the end all be all.
Definitely. And that's the way it's looked at. And the goal is orgasm, right? It's goal oriented.
You're right. Yeah.
So one of the things we were just talking about, something popped in my head, but I lost it again. I think that's something really important to help educate people on, right? It doesn't have to be the end of the experience. Like, you can do so many different things for pleasure, and you get to define what sex is for your relationship. And as you were talking earlier, I was thinking in my head, we kind of have this natural progression in sex, but there is no hierarchy of sex acts, right?
Yeah.
You can do anything. You could just be a heavy makeout session, and that might be sex for your relationship for that night. But
totally.
You get to define that.
I like to think, I remember being taught the pleasure wheel and how much that changed the outlook on how I work with couples, defining what their relationship is. Because you're right, there isn't a hierarchical way. And even as we're talking about it, we're talking penis, vagina. And in the situation, if we have two men, or if we have a polyamorous couple, there's so much that you can do that does not have to be based on how long you can go without an ejaculation. One thing I love, so speaking of the pleasure wheel, the way that I think of it is, essentially, if you've got you and your partner, or your partner's in the center of this circle, and there's all these ticks around it, what are the things that you love to do that feel connection? Because even as I work with males or partners, the majority of what I see, even if they're having sex 2 or 3 times a week, if one partner is not involved, or is just kind of laying there, like, I think Natasha Parker's says like a dead fish, where he's like, meh. The other partner is not excited about that. It is not about achieving orgasm. There's a connection thing. And I think a lot of people expect men to just be experiencing like, oh, well, as long as you're getting off, like, then we're fine and I'm doing my job. And a lot of men complain about not being satisfied sexually when it is just having the act of sex. They want to be wanted. They want to be desired. So how do we experience that in a relationship? Do you do that through, like you said, a heavy makeout session? Can you do that through holding hands, through going on a walk, through talking dirty and then watching a movie? Or, the thing is endless. That's what I love about the pleasure wheel. What do you like to do to feel connected to your partner and that makes you feel desired? Sure, sex is in there. Awesome. But now what,
Right. And this is part of what I teach couples too about consent. And I know we're getting a little off topic a little bit. But,
I think consent's always perfect for these topics.
Always on topic, right? But about consent is because a lot of times I think women feel this pressure, right, to have penis vagina intercourse, and that's what we have to do, and that's what I have to do to keep my man happy, in quotes, right? Because that's what they kind of learn growing up and they see from media again. And so this is a great way in which you can say, you know what, I'm really not in the mood tonight, but I would love to give each other back rubs. Or can we take a hot shower instead? Just offering something where it doesn't feel like the other person's being completely rejected, and it starts to close that gap. Because that's the biggest thing I see couples for is a gap in desire.
Mm-hmm. And I can almost hear some of the men's eye roll when we think of the back rub. It's like, oh my gosh, I always rub the back.
I know. I tell them when I do the pleasure model, sex can be anything, and I go through everything at the very end. I say it can be a foot rub. I say men don't usually like it when I say that.
That's just like, oh my gosh.
She's
that
like,
would just...
we do that all the time. We've been having sex this whole time.
Yeah, but
that's why it's mutual, right? It's mutual shared pleasure.
Completely.
So it's important. Shared values, shared pleasure.
Yeah, I completely agree. And even if you're thinking, I give back rubs and back or foot rubs all the time, I mean, it can definitely pay off. You're giving into that emotional and that sexual bank account. And again, it's not a demand. However, from my experience working with different couples, the majority of people are a tad more open to sexual interactions that you would like if you were open to their sexual interactions as well.
Yeah. And what we have to think of is, this is PE that we're talking about, but as we get older, our bodies change, right? Mm-hmm. So when we go through menopause, intercourse can be really painful for women because they don't have as much lubrication and just the changes that go on with the vagina and the vulva. Mm-hmm. And men, as they get older, erections aren't as easy. They do start to decline, and we do have some degree of erectile dysfunction. But people are having still really good sex lives well on into their 50s, 60s, 70s, 80s, and 90s. Mm-hmm. And we know that because the highest rate of STDs in the country right now is in retirement communities.
Yep.
And I tell clients that, but I say, I don't say that to scare you. But, there's reasons we can talk about. But it just shows you we're born sexual beings and we die sexual beings. Mm-hmm. So for most of us, this desire to be with our partner in this way, it doesn't go away. So if we only have this penis vagina performance model in our head, man, we're going to have some lousy sex and we're going to feel like failures a lot of the time.
Yeah. There was an elderly...
if we adopt the pleasure, then we're going to do a lot better. Sorry, Braxton. Go ahead.
No, you're fine. We got to adopt the pleasure versus the goal-oriented, the pleasure model. And now that I'm thinking of it, that story is for the next podcast because we're going to be talking about erectile dysfunction and delayed ejaculation.
Yeah, I know. We're kind of mixing them all together.
Well, but it's so hard not to talk about it because they all blend.
Connected.
Yeah.
Well, and most men with PE often have some degree of erectile dysfunction accompanying the PE. And what happens, I find, with my men that struggle with erectile dysfunction that are older, they're like, oh, it's up. It's hard, finally. Like, let's go. And they just don't, they're so excited and they don't want it to go away that then all of a sudden now they're like, oh, now I have PE. I've always been able to last long, but now I have PE. So a lot of these just kind of are interchangeable and really relate to each other and are connected.
Most definitely. And even as we're talking about delayed ejaculation and PE, even though they seem mutually exclusive, they share a lot of similar issues. And we'll get into that in the next podcast. I am curious about maybe some myths. What are some myths that we've got when it comes to PE? One of the ones that I think of the most is that porn causes PE.
Yeah. No.
No.
Yeah. So really with premature ejaculation, and even with erectile dysfunction, what happens is, even if you've been masturbating from the time you were young till maybe for 20 years, and if you've been masturbating maybe 10 hours, a week to porn, then you might have to do some retraining. That is one thing that I always kind of assess with men in session is, what are your masturbation patterns? Because sometimes, it can be so many things. So this is one thing that comes up a lot. I'll have guys that come in and they're struggling with PE, and they're like, well, and I ask them, how often do you have sex? Right? How often are you guys having sex? Well, we just had a new baby and we're having sex like once every 4 weeks. Well, yeah, you're probably going to have a hard time lasting a long time, right?
Yeah.
Or you've never had sex before. You're going to have a harder time lasting long. So typically it's not related to porn, because that usually comes up in more of a question of delayed ejaculation or ED because of their masturbation patterns.
Yeah, and
I haven't seen it associated with PE.
Yeah, what I hear a lot from clients, and even when it comes to the myth of this, is it's like, again, the word is cause. Pornography is not causing premature ejaculation. In fact, there was a really interesting study that Debbie Hubernick was a part of, talking about, they were looking at porn use, and some people were given, porn to look at for, I can't remember if it was like a week long, something along those lines. It was a week, and they were watching the same type of pornography, and they noticed that there was some different ejaculation patterns when it came to how fast they would ejaculate. And then they would switch up the pornography to something different, and the novelty behind it was really what was going behind, is like having a different something different to view, something that is novel. And they found this to be somewhat similar to what is in the relationship. If you're having similar sexual interactions every single time, you can almost base out, we're going to have sex tonight. This is going to happen, then this is going to happen, and this is going to happen. The body gets used to that, and either, it can make you feel anxious because you know what's going to happen, or you feel like you know what's going to happen, or introducing novelty can be a little bit different. But you're right, the pornography piece has an effect on it, or can have an effect on it, but it is not like, you looked at porn, you have PE, that's why you're experiencing that. From my understanding, there's not a pill that cures premature ejaculation, or masturbation isn't causing that.
They've done some studies, and I'm always hesitant to even talk a lot about this, but they've done some studies where tramadol, which is for pain, can sometimes help last longer. Sometimes Wellbutrin, I think that is also, I never know what the brand name. I think brand name's Wellbutrin, generics bupropion.
Bupropion, yeah.
Yeah. And that is supposed to help sometimes. People last longer, and then they have like the sprays and numbing creams that people can use.
Yeah, like in the condoms and stuff.
Like, I haven't found it to be like really great results, but that there are some options. It might give you another 30 seconds, a minute. But that's really all.
Yeah,
that there is.
The thing you touched on as well is if you're experiencing what you feel is premature ejaculation, and you look at your life and you've just barely started having sex, you're newlywed, or you just your first couple times, it's very, very common to ejaculate before you're even having any type of intercourse. Or to go very quickly. I mean, again, it's the excitement, the newness, the novelty. I mean, this is a brand new experience, and we'll talk about this too, but it's quite common to lose an erection or to have delayed ejaculation. There's so much that goes into how the brain works with this.
Yep, definitely. Yeah. And I think one thing to really, understand too, and that women, also need to understand, or just partners. I shouldn't be using, I mean, for the purpose of this podcast thing, we're talking a lot about a cisgender couple, but, really the partners need to understand that, if you're not having frequent sex, that's one way to increase, hang time, right? Is, have more sex and then you might be able to last longer.
I love hang time. That's my favorite word.
I know. I think I got that from Paul.
That's perfect. Some hang time. So let's talk a little bit about what you can do. Maybe some helpful hints, things to try if you're like, I am experiencing premature ejaculation, or I'd like to extend my hang time.
Right.
Then, what are some things that partners can do? What are some things that men can do by themselves or in partnered sex?
Sure. So one of the things that, if it is related at all to erectile dysfunction, Viagra and Cialis can be helpful. And we'll talk more kind of about that when we touch on the erectile dysfunction part of this podcast. But one of the biggest things I do is teach the client relaxation techniques and mindfulness techniques. And for a lot of people, you might know what mindfulness means. Others may have no clue. Mindfulness is really just the learning to be present, just being in the moment. They say that we live 95% of our lives in the past and in the future, and only 5% of our lives in the present.
Wow.
And usually couples will come in and they know when their partner's off somewhere else, right? It doesn't feel as connected. You're not looking each other in the eye. You're not in the moment. So I teach them mindfulness techniques. And it helps them to have a greater mind-body connection. And then, also just going along with that, right? Teaching them to be present during sexual experiences. Not thinking of grandma, not thinking of the basketball game.
Yes.
There's other ways of lasting longer rather than distractions.
Definitely.
So those are some of the treatment options. And then one of the kind of popular ones is the squeeze method.
The squeeze method.
And you can do this, or a partner can do this, but basically the man stops manual stimulation or intercourse when he's close to ejaculating, and he has his partner squeeze the glands of the penis or right below the head of the penis until his arousal subsides. And then the start-stop method, it's clench or tighten and hold the PC muscles until the urge to ejaculate is gone. Mm-hmm. One of the things that I do with clients is I tell them to pick a number between 1 and 10, 1 being not aroused and 10 being just like point of no return.
Point of no return.
Already ejaculated. And so I tell them if they're comfortable doing this with themselves based on belief system, right? Self-pleasure is I tell them to masturbate, to pick a number between 4 and 5, and then to practice masturbating to that number. And if they're able to do that, then pick a higher number, like maybe a 6 or 7, and practice masturbating to that number and lasting a long time. And then same with, then to like a 9. And all the while being like present, being mindful and paying attention what's happening in my body, right? Because most of us can kind of tell, like, certain things will start to happen in our body before we ejaculate, right? Are my glutes getting tight? What muscles are tightening?
Yeah.
What sensations am I feeling in my body? Because a lot of times they just don't know. And I found in my experience that these men do everything fast. They drive fast, they eat fast. So part of that mindfulness piece is teaching them to slow down with everying.
And that can be really hard. Yeah.
They usually show up early to appointments. They do everything fast. So that's one way. And if you're not comfortable doing that with masturbation, you can do that with a partner who can have them manually stimulate you, and same thing.
And that involves a lot of communication too. This is what I'm experiencing. I'm at 7.
And a very patient partner, right?
Yeah. Yes.
Somebody who very patient and willing and able to do this with their partner.
I think that's a huge part of what partners can do too. A lot of times you feel like the partner is saying like, well, this is your problem, figure it out because I can't do anything for you.
Go get therapy.
Go get therapy.
Yeah. And they're sending each other to the office.
Yes, they're sending each other to go.
Which is so shaming, kind of, right? This is your problem, go fix it.
Yeah, you're broken. Now go fix it. That's not the case here. Yeah, we're working with PE, but at the same time, I mean, use humor. I mean, you don't make fun. I mean, we're not talking making jokes like neener, ha. But using humor like, oh, wow, like whatever it may be, like to make it a comfortable situation for your partner and make it easgeing. It's fine. And again, you can say like, hey, well, let's continue on with me and we can start back up again. If you
can also make it really sexy too, right?
Yeah.
With a partner, it can be really erotic. Just like using tools, bringing certain things into the room can lube, right? People sometimes don't want to use lube because they're like, oh, got to get it out. We squirted and then it's like this process, but you can make that really erotic and fun.
Yeah.
And it doesn't have to be awkward. And so same with this, you could make it fun, right? You could just have a signal, or when I touch your hand like this, that means stop for a minute. Whatever you want to do to make that, more exciting. But it's a fun way to practice, right? You get to practice with each other.
Definitely.
Sexual experiences. And then after that, then the woman can get on top and use her vagina to do the same thing.
Yeah. So either from manual stimulation with your hand or using the vaginal canal.
Penetration, yeah.
And when it comes to, I think what you were saying there with the partner being present, having communication, making it fun, being supportive, and also being able to experience the pleasure you need to. That involves that pleasure experience that we were talking about. I think for the male, don't get down on yourself. I mean, if you're constantly apologizing or you're like, oh my gosh, this is, I'm so sorry. It can get difficult for the partner. It can be annoying. It can also be like, oh my gosh, I don't know how to yeah, it's okay, but I still am turned on right now. But be like, what else can we do? Let's do something else. That's totally fine. Oh my gosh, that was a lot. Let's go. Let's keep going with this. But that's something that I think for both individuals to have that communication, don't continually apologize, really make this something that can be fun together.
Yeah, and there's all kinds of things, right? Going back to that you can be doing for sex. It's also, I think, important to understand that PE can be kind of, it can take commitment, right, to this treatment, and it can often be lifelong. So if you want a healthy sexual relationship, this isn't necessarily something you can just send your partner in to the sex therapist to get fixed for. Like, this goes better when you have a supportive partner who's willing to either maybe come to therapy with that person to learn the same things, or at least be able to have an open, honest dialogue and discussion about how to work on this together as a team. Yeah,
because if not, when we keep exacerbating issues with anxiousness or whatever's going on, and it makes it for people end up just avoiding sexual experiences because it's too shaming, it's too anxious.
Exactly.
Yeah, there's a lot that's involved within it. I've also heard things like pelvic floor exercises. Do you know if that's something that helps with PE?
Yeah, so I actually recommend pelvic floor physical therapy to pretty much probably the majority of my clients. But oftentimes, if anyone knows anything about this, it's typically kind of seen as something a woman does, but it's actually extremely helpful for men and they can go see a pelvic floor physical therapist to help them learn better exercises to control this, exercises for delayed ejaculation, help for that, and also for erectile dysfunction. Similar to with women learning Kegel exercises, strengthening the pelvic floor and strengthening the muscles. And going along with that, it can also be really helpful if the partner learns, and if they do this together, they can also learn when their partner's close to ejaculation and then kind of stop, right? For a minute and then let it die down and then start again.
Yeah. And I think having a conversation together with your partner and asking what their experience is, because some people really worry like, oh, if we stop sex, then I think there's I keep going back to these jokes, but the joke of like, I'm not on a bus, you know, the partner being so angry and frustrated that we have to stop and go and stop and go and stop and go. But that's not the experience for everybody. But ask your partner what their experience is. What is that like for you? You know, experiencing PE, or what is that like for you when this happens? Or what's it like for you? Well, that's kind of sexy to me. I really feel like I'm a turn on to you. A lot of the times there's a discrepancy between what you're thinking and what your partner's thinking, what they want, what you want.
Which is going back to what I said before, and I always ask the men, have you talked with your partner? Are you sure that they want you to be lasting longer? Because oftentimes that's not the case.
Yeah.
Oftentimes they're fine, right? Especially if it's not, you know, clinically diagnosed PE. So some of the signs are veins begin to bulge in the penis. The penis gives a sudden throb. The head of the penis darkens in color. The testicles ascend into the groin and the muscles begin to tighten. So those are just some of the ways in which you can kind of, you or a partner.
Start to notice.
Yeah, exactly. So these techniques can take days or weeks or months to master. So be really patient, kind, and gentle with yourself and with your partner if you're experiencing this.
And I think one thing to touch on at the very beginning, you said, you know, then in a research, and some of these researchers, they found that in between 2 to 8 minutes is average. And as I was reading one of those research reports, they found that it was very interesting because people were identifying if they were satisfied with their sexual experience and their time and all this other things. This was done across 5 countries. And they were saying that it was interesting because there were many men who lasted for a minute or two and they were satisfied. They were really satisfied with their partner, and their partner was satisfied with the sexual encounter, their sexual experience. And then they said there were some men that lasted 15 minutes and either they weren't satisfied or their partner wasn't satisfied, or both weren't satisfied. And it really comes down to, okay, so you ejaculate after 15 minutes or after a minute. What is the quality of the sexual experience you're having? It is not about the ejaculation.
Right. Or the time. Exactly.
Or the time. You're right.
Yeah, exactly. Well, and I think you touched on this a little bit, but really one of the biggest things I think too is to just that partners usually find it to be kind of a turnoff and annoying when there's constant apologies and self-criticism for it.
Yeah.
So really just not to do that anymore, right? And there's a great book. I forgot about this, but...
Yeah, what are some resources?
She Comes First. And Ian Kerner wrote the book, and he talks about being a person that struggled with PE for, I think, lifelong PE. And so he mastered the art of cunnilingus, which is oral sex on a woman, in order to have that kind of be his thing that he, felt really good about. And so I think that's a huge piece of it too. Find other things that you feel like, you are really good at, and ways you can have this incredible pleasure. And so it's not just this based on this one specific way that's not working.
Yeah.
Or not going well, if that makes sense.
Again, finding a different way.
Yep.
Cool. I think that covers a lot of what we were planning on going over today. And I mean, is there anything else that you would add to PE?
No, I think just learning many other ways of making sex enjoyable and fun with a partner, so it can be really satisfying. And a couple more treatments though, really quickly, maybe. This is one I like to touch on. Sleeve or fleshlight to practice and learn control can be really helpful, because I think it's a little bit more similar to the feel of what it would be like to be inside a partner, and to have penetrative sex. And so I think that that's a good way to practice. And then we talked about some of the numbing sprays and creams, and sometimes those numbing sprays and creams can numb a partner. So one that I found that is not supposed to numb a partner, and you put it on about 10 minutes before a pre-boost, and they're wipes. It's PREBOOST. And then we talked a little bit about this, I think, Braxton, but pills and SSRIs are a common form of treatment. Pratcial, Prozac, Zoloft, and then the Wellbutrin.
Gotcha. Cool. Yeah, I think that I think we're ready to move on into delayed ejaculation and erectile dysfunction, and that is going to be next week's episode. I'm gonna release them in week episodes, but we'll catch you on the next episode with delayed ejaculation and we just did premature ejaculation. Delayed ejaculation and erectile dysfunction. Confusing. I know, it is just all over there. There's ejaculation.
Exactly.
All right. Thanks again for tuning in to Birds and Bees podcast. We'll see you in the next episode.
Thanks.
This has been another episode of the Birds and Bees podcast. Thank you for tuning in. If you have any questions about the show, comments, or questions you would like addressed in another episode, please give us a call at 385-449-1818. Leave your voicemail and your question, or you can also email us at birdsandbeespodcast@gmail.com or visit us online at birdsandbeespodcast.com.